For our Thursday morning coronavirus briefing. So let's start off with some good news today. For those of you who are followers of case numbers, so our numbers of cases throughout the U.S. are still declining. They're still not declining quite at a rate that I would like to see, but they're declining nevertheless. A few places where it's a little stickier yet is Texas, Georgia, and Florida, where the case rate is not declining as fast as some other areas. The Midwest, actually, there's some states in the Midwest that are still seeing some increases, in Hawaii and Alaska, and some of the places that weren't quite as affected earlier on are seeing increases in rates too. By and large, the states that are more adherent to keeping people away from large crowds and from atmospheres, indoor atmospheres, particularly like bars and some fitness centers, are doing better than states that aren't. And then states that are masking and that have mask mandates and where people are starting to embrace masking are doing better than states where they're not. So I say it every week, say it again, masks work. They help protect other people, and as I mentioned last week, there's some information now that masks actually might help protect you, because people who wear masks, if they get coronavirus, they tend to be much more likely to be asymptomatic or have milder disease. And it's probably because if they do get it with their mask on, they're getting less virus. So wear your mask. Masks work. Cases here in North Carolina also continue to decline. If you're interested, you could look up in the, just Google North Carolina COVID dashboard, and you can follow the cases themselves. It's kind of like watching a hurricane come across. As the numbers decline, it kind of feels good, and that indeed is happening. And actually, we've had a 50% decline in the number of cases in the state since our peak, which was in early July. There are still some areas in the state, though, that are struggling, particularly more rural areas now, where the case rates are much higher. In other words, the number of cases per number of population in that county is much better now in urban areas than in rural areas. So that's kind of shifted a little bit as the pandemic has matured here in North Carolina. Here in the Triad, our cases are also coming down in all of the areas in the Triad, including here in Forsyth County. They're not quite down to that very low rate that we were enjoying in April and early May while New England was struggling. They're not quite down that far, but we'll take it, won't we? So why are they coming down? I think a lot of it has to do with masking, and I think people's behaviors are starting to change some. So it's working, and that's good news. What's ahead for us as we go into the fall? Well, I think we're going to have, a month or two kind of like it is now. And as we get into November and December, we'll have to see how things go, because that's our usual respiratory virus season. And there's obvious concern that COVID might be worse then, and then we might have some flu around, and then other respiratory viruses too. The thing that for us in healthcare, and then also for people out trying to do their activities, is if they get sick, is we're going to have to sort people with COVID from people who have flu, from people who have other viruses. And so hopefully over the next couple months we'll have more testing platforms that can be done in doctors' offices and urgent cares that'll do that sorting for us. There are some on the launching pad. A little bit of a word about immunity. So some studies that came out this week that are worth mentioning, all of which that are somewhat encouraging actually. Remember, we've been saying that we don't really know how people get immune to coronaviruses, whether the antibodies they develop actually protect them, how long it does protect them. It looks like that some of the antibodies that are developed when somebody gets sick with coronavirus are called neutralizing antibodies, and these antibodies actually will latch on to the virus and neutralize it, and then the body cleans it up. It does appear that most people who get COVID do develop neutralizing antibodies, and we're getting more information that these neutralizing antibodies work. For instance, there was a fishing trawler of all natural experiments in the world that was off of Alaska, so sort of a different world's deadliest catch, I guess. Almost everyone on that fishing trawler got COVID because a couple people brought it on board when the ship started its voyage. There were 3 people who didn't get COVID at all, and it turns out those people were studied, and why is because they had neutralizing antibodies, and it was likely because they had had COVID before the ship sailed 2 or 3 weeks earlier. So it protected them. That's good news. That's good news for those of people who make vaccines, because we want the neutralizing antibodies that vaccines make to work. And so there are other studies coming out now too where it appears that these neutralizing antibodies, even in modest amounts, seem to be protective. And there are other aspects of our immune systems too, from our memory cells and our T cells, that seem to be helping. So a little bit of good news on that, and we'll have to see. We still don't know how long it lasts, and we still need to know exactly how robust it is. But I think by Christmas time we'll know that stuff. So I'm pretty encouraged by it. So what's in the news this week with COVID? I guess the elephant in the room is Chapel Hill, right? Chapel Hill started classes about a week and a half ago, and I got through about 2 weeks of classes, and then because of cases on campus and associated with campus, decided to go to all remote learning, and they're sending kids home from their residence halls. So what happened? Well, sort of my take on it. And so you have to understand a little bit of the culture of Chapel Hill and the culture of the community of Chapel Hill. Big college, small town. So when you have that kind of dynamic, you end up having sort of a bohemian type lifestyle sometimes in these college towns. And for those of you who have lived in them, you kind of understand there's a student culture, and there's a lot of people who don't even go to college, but they're young and they enjoy that kind of lifestyle. And over the summer, there were cases occurring in that group of people. So before school even started, before even students moved into the dorms, so there was this background of COVID in the young person community. And then when about a week or two before classes started, people start moving back in, finding apartments, moving into the residence hall and such. And somewhat traditionally, that's a time of exuberance and happiness and social activity. And that was occurring, and students were getting infected in these venues. I would say that a lot of it was activities that if you probably laid it out on a multiple choice question like you would get in college, the answer would be yes, not wise, but they occurred nevertheless. So large groups of people in closed areas, a lot of it indoors, people not wearing masks. And so once the infections got into and the kids got into the residence halls, the dormitories, it can spread very quickly in that kind of setting because people live together, share bathrooms, roommates, so on and so forth. And the number of cases just became so large that the university couldn't sort them anymore in order to isolate and quarantine. And then that was why the decision was made to send them home. I think it was the right decision at that time, and because I think it would have been, once something gets kind of to that level of numbers of cases, it's kind of hard to stamp it back down again unless you do some, kind of drastic measure like sending everyone home. So I have a couple things to say about it. One is that college kids do pretty well with COVID, and while the odds of having a severe case are really low, it's not zero. And so young people need to pay attention and heed this. It's not cool to get COVID. It really isn't. First of all, no one likes being sick, and second of all, if it's 1 in 100 people get a severe case and need to go to the hospital, that doesn't seem like a lot, but if you're that one, it's a big deal. So you have to pay attention. The second thing to point out is that for those parents who've had their kids move back in with them, yes, you may have thought that you had your college kid out for a semester, but they're back, and now what are you going to do? Well, first is that if they were in college and they're healthy, then that's great that they are. But really, anyone who is in that situation, particularly in the residence halls or living in a fraternity or a sorority, or experiencing all of the exuberance of coming back to college off campus, really should quarantine for 14 days. Because there's enough likelihood that you could have been exposed. So lay low and chill, do your online learning, and for 14 days or so, let's stay home and not go out and about. If you have a child who, and they're really not children, if you have a student who came back and they had tested positive, you have to make sure that the isolation is in place, and even even then, you want to make sure that even in your own household, that if you can, to separate their living from your living as much as possible, and that's a situation where everyone's going to want to wear a mask, particularly the person who tested positive. What happens is when you get a large group of people and there's a large number of infections, and then you send everyone home, it goes to all 100 counties, right, in our state. So we want to make sure that those cases don't start pop-up clusters in other areas. So it's important to, if you have questions about that, talk to your physician. Or talk to your public health people about it. What about other colleges? There are other colleges that have had issues, and I wanted to bring up Notre Dame. So Notre Dame has had its. They tested every single person coming onto campus, and they had a very, very low rate, about 0.2%. Of their people coming onto campus at the beginning of the school year were positive. But it only took about 3 weeks for cases to start to occur, and enough cases to occur on their campus that they also went to 2 weeks of online learning. So being test negative does not mean you're out into the clear. Being test negative just means you don't have it today. And so you still have to be safe. You still have to wear your mask and make wise decisions about where you go and how. And in the college situation, a lot of people think about it as being parties and bad choices about going to parties. It's not all just parties, but it's meeting friends for breakfast, getting together with your 4 or 5 friends you haven't seen all summer. And even though it may seem like a small number and innocuous, you still should be wearing a mask, and you should still be personally distancing. you should still be doing hand hygiene. And those things are important, even though it's not a large party. So, just a word about daycare. The number of outbreaks or clusters, a cluster is defined as 5 cases in 2 weeks, and daycare centers in North Carolina still remain low. In fact, I think I said 2 weeks ago we've had 14. We've only added a couple, 3 since then. So the things that daycare centers are doing to keep the kids safe and the staff safe seem to be working, and that's good as we start to think about having some of our schools open up. So with that, I think I'm going to go ahead and go to the questions that were submitted from last week. And first of all, Shannon asks, in outpatient primary care, when we're testing asymptomatic, non-exposed patients needing COVID screening for college or school, do you recommend we only do PCR testing, or is the rapid antigen test good enough if we have it in our office? You know, I think the rapid antigen test is good enough, actually, because it's already a low likelihood situation. So in people going back to school across the country, the rate's somewhere between 0.2 and 0.5%. So it's already unlikely that they will have it. So if you do an antigen test, the negative predictive value is about 99%. So you can be about 99% sure if that test is negative that the person doesn't have it. And that's good. So yes, you can do antigen testing. I call these administrative tests, you know, it's like, well, the workplace requires it, or the school requires it, or something. Or you need it to go to Alaska, for instance. Alaska requires testing within 72 hours if you're going on a fishing trip up there. Those are administrative tests, and the antigen test is fine for that. Stephanie asks, some companies are requiring some of their management to self-test every 2 weeks. I fear no one is going to go through far enough up into the nose or leave it up for the allotted amount of time. Does this cause false tests? If employers are requiring these, shouldn't a medical professional be administering these? Excuse me. Hang on a minute. So that's a really good question. So early on, we thought that the nasopharyngeal test, which is that part of the nose which is way back here in the middle of the head, was the best one to do. We now have information that just doing the nasal vestibule. What is the nasal vestibule? That's that fleshy part of the schnoz that sticks out here. So just doing that part is good enough. You don't have to go back, but you want to make sure you get a good wipe down in there. And that's probably good enough. And then also, we now have 5 saliva-based tests that you can do, and just put some spit, good amount of spit, fill it up to the line, and then you send it off to a testing company, and they'll do either molecular tests or quasi-molecular test on it. And the sensitivity is a tad bit lower on those, but you know, again, it's good enough. So I think if places are having people self-test like that, I would go with either just the vestibule or a spit test. The spit test is even a little bit easier than getting the swab out. So I might add, I'm not so sure how useful swabbing somebody every 2 weeks is, or testing them every 2 weeks in a workplace situation like that. If a person is doing what you need to do to protect yourself, I'm not so sure how much routine testing actually adds to the safety. Jennifer asked, my child's daycare does temperature checks at the door, and parents and teachers are expected to wear masks while outside. No parents are allowed inside. However, I've discovered that many of the caregivers are not wearing masks inside, or wearing them under their chins, and are directing children to take their masks off. What standards are daycare centers being held to? Well, there's sort of there's a legal standard and then there's a community standard. There really isn't a legal standard for a daycare center. Now, accrediting and inspecting agencies, I'm sure, are taking those things into account now because they always focus on health and safety in the daycare center, everything from diapering practices to cleaning and so on and so forth. So I'm sure they're looking at the mask aspects. Wearing a mask under your chin doesn't work, so don't wear it under your chin. It needs to cover your nose and your mouth. And really the staff should be wearing it in the daycare center. And actually children should be wearing them too if they can. The very young kids, it's harder. And daycare centers have taken other measures for those. But and it does seem to be working. Like I said earlier, the number of daycare outbreaks are low. But you might want to bring that to the attention of the director of the daycare center, in a nice way, that's just an observation you've had, because it is a way to increase the safety of a school or daycare environment. Jane asks, can you give PPE guidance to school service providers who work with special needs children who can't social distance or wear masks? Please help protect myself and my aging parents. Well, so this is a bit of a special situation. So there are special needs kids who usually, due to underlying chronic medical problems, really can't participate in an online learning experience in any kind of meaningful way. So there is I think in most school districts we'll be bringing these kids back to their usual special needs classrooms and doing instruction for them in person, because it's the only way to do it, and it really is important that these kids be not left out. So if you're a care provider for that and for these special needs kids, because they have chronic medical problems, it's a little bit like how we would do things in a nursing home, I think. And so the PPE would be the same as what you would be using in a nursing home. That's either an N95 or a surgical mask, medical grade, and a gown and an eye shield when working with these people. And I think that a lot of the counties who are thinking about doing this in the near future are going to be, you'll be hearing more about that from them as these protocols are put in place. So it's a very good question, but I think we're able to, in healthcare, that works for us. And we've been doing this now for patients with known COVID for 5 months, and our PPE protects us. So I think you can rest assured with that. So my son Christy asked, my son wants me to get tested before meeting my newborn granddaughter in 3 weeks. How early should I get tested to get results back and still be deemed a recent test? I get this question a lot, and because everyone wants to protect our newborn babies. Fortunately, newborn babies seem to not get COVID as much or as seriously, and that still holds out even 5 months into the outbreak. So that's good news. But still, I understand. And the thing to do is, if you're going to be visiting your grandchild, a newborn grandchild, or helping care for them, then you become part of that family's bubble, right? You're part of that family's pod. And so you need to kind of integrate into those families' practices. And you should make sure you wear a mask when you're outside of the home. You will probably want to wear a mask while you're inside your grandchild's home. And you're going to wash your hands before touching the grandchild, and you're going to wash your hands after touching the grandchild, or perform hand hygiene with sanitizer. So wash in, wash out, and keep your hands real clean. And then if your son and daughter-in-law or your son-in-law and daughter want you to have a test, then you can get tested. So what we do for surgical procedures per se is we test within a week of the meeting. And that is balancing the practicality of getting the test early enough so you can get the result back early enough with having the window still be valid. Much past a week earlier, then you could easily have been exposed in the interim, and so it's not as meaningful. The good news is that a lot of our major laboratory vendors, such as LabCorp and Quest, and those that a lot of us use, the turnaround time now is down to 3 days. So in the past couple of weeks, it's gotten a lot better. So I think if you get it somewhere between 3 to 7 days beforehand, pick 5 days, for instance, I think you'll be fine. You'll get the test result back in time. And if you're unsure, ask the provider, how long is it taking for you to get your test results back? It's a little bit harder sometimes to find places that'll test people who don't have symptoms. But I was talking with our colleagues at the county yesterday. So there's basically weekly, the county has sites where you can get tested, and you don't need to have symptoms to get tested in those places. So, it's getting easier to find. Elaine says, my adult daughter is 2 weeks recovered from confirmed COVID. Is it safe for her to visit our bubble without masking? We're 65 years old. Yes and no. So 2 weeks ago means that you're over it. Okay, unless you have an unusual health problem or you're immunocompromised, virus is gone within 10 days. So if you're 2 weeks out, you don't have virus anymore. So you don't have to worry about it from that aspect. But the CDC, we're still, is recommendations, and I myself says, even though you've had it and you're over it, that you still need to mask, and you still need to hand sanitize and avoid the crowds and do all those things that we're asking people to do anyway, because it's a little bit unclear yet whether you can catch it again. As time goes on, it seems less likely, but we're still not sure. So you should still do your precautions even though you've had COVID. But you don't need to get retested again in most situations for 3 months after you've had COVID, and you don't have to be quarantined if you've been exposed, if it's been within 3 months. So they probably should still wear a mask, but at 14 days, you don't have to worry about them infecting you. Carrie, are oral tests effective? Yes, Carrie, oral tests are effective. A little less than the nasopharyngeal test, but they're pretty good. I'm still waiting to find out about the last one, the so-called Yale saliva test. Need a little bit more info to know 100% for sure on that, but the early information looks like it's pretty good. A little less sensitive, but for most cases sensitive enough. And certainly a lot easier to do, to spit in a cup rather than to have a swab put back. So, there are a lot of people still doing swabbing, and that's still the gold standard. But the oral tests seem to be like they're going to be okay. So Daryl says, I'm in the Wake Forest Baptist COVID study, and my first test was negative. I took my second one last week, and the results have not come back yet. I'm over 50, and last week I received the shingles vaccine. Any concerns that my next COVID test might detect the Shingrix vaccine and create a false positive? Actually, probably not. The antibodies that are made because of the Shingrix or the shingles vaccine are so different from COVID that there really shouldn't be any crossover, and so I don't think you need to worry about that. Kimberly asks, how long is the flu shot effective for? Is it too early to get a flu shot now? No, it's not too early to get a flu shot now, and they are out there. So I would probably get one anytime in the next month. And it's better, like most things, to not put it off and just get it done when you can, and when you got some free time, and when it is most convenient for you. How long is it effective? The flu virus can be a little bit shifty, unlike COVID, which seems to be fairly straight away. It doesn't change much. Because of that shiftiness, the flu virus is good. The flu vaccine is good for about a year, and after that, it starts to lose some of its robustness. And could the flu vaccine, Margaret wants to know if the flu vaccine can be given at the same time as Shingrix. Yes, it can be. The standard flu shot can be given at the same time as a Shingrix shot. Different arms, but they can be done at the same time. And then Patty asked the million-dollar question, is herd immunity possible? Herd immunity is when enough people in a population have had COVID that it'll slow the spread of COVID should it come around again. Herd immunity is possible. We see it with a lot of other things, a lot of other viruses. There's a good many of us, including myself, who think that herd immunity is probably going to be a part of how COVID eventually diminishes in its transmission. Interestingly, there's just some information out of New York City based on antibody testing that was done across the boroughs of New York. It was just in the New York Times this week, actually. And the health department did it. And they took antibody tests from any vendor, any doctor who ordered, anyone who got it, and then got the results, and then looked to see how many were positive. And it turns out in New York, during their big problem in April and early May, Queens wins. It was more people converted and had a positive antibody in Queens, and certain zip codes were affected more than others. In some of those areas, the percentage of people getting it was up between 30 to 50%. And that is getting into a range where you might think about herd immunity starting to happen. Other areas of New York, though, particularly Manhattan, Staten Island and such, had antibody positivity more in the 12 to 18%. And that's probably not high enough for herd immunity. Here in the Triad, I think we're running somewhere between 5 to 10%, depending on the zip code and area. And that's probably not enough for herd immunity. But having said that, if you're in a certain population of people, so if you're in a certain zip code where the percentage is more like 20 to 25%, yeah, that might help you down the road some because there's enough people who've had it. We'll have to see. I think we're going to know more about this in the next 2 to 3 months, actually. And some information, like the study being done at Wake Forest Baptist Health with looking at antibody positivity, is going to help us know that as time goes on. So, real good question. Fingers crossed. We would like to think there is going to be some herd immunity. And then if we all get vaccinated on top of that, then we can start to think about, 60, 70% of people having immunity. And I think, my prediction is that's when we'll start to see COVID roll over. And hopefully in a year or so, we might be getting near that. So we'll have to see. So with that, I'll open it up to people in the room who might have questions.
You mentioned at the beginning that there were some states, a lot of states, the numbers were going down a bit, but there were some that they were not. Texas, Georgia, Hawaii, yeah. I believe you mentioned. Do you have any reason for that? You mentioned that a lot of states you thought it was because the reason the numbers were down were because of masking mandates and things like that. Is it safe to say then that the states are see it's going up don't have those mandates, or are there other factors?
So the question is for the states where the numbers are going up or at least hanging in there and not changing much, is it because of lack of masking mandates or other mitigations? Yes, I think so. If you look at the states that are having the biggest problems, there tend to be states where masking's not being done or being asked to be done, or bars are still open, movie theaters, bowling alleys, and so here in North Carolina we've kind of taken a middle road approach to opening things up, and I think that's helped us. But some states have not. Hawaii, I'm not exactly sure about. Their situation's a little bit different because of their geography. And then the other thing is that if you've had a state that really hasn't had much at all, if they start to see some, it's going up, right? Because it goes from almost zero to be going up. So you have to kind of look at that too. But yes, I think the states that are really starting to have troubles again are ones that aren't masking and personally distancing.
I've got a few questions I'm going to try to ask out for another story.
Yeah.
On this, and it goes more about the common flu shot and stuff. And why are flu shots so important this year?
Yes, why are flu shots so important this year? Flu shots are really important this year, and for two reasons. One is that we don't have a way really of slowing down COVID with the shot. we do other things, right? The masking and things. But for flu, we do have a way of slowing it down, and that's with the flu shot. So when you have a time of the year where both viruses might be out and about, if you can decrease the impact from the one you can actually help with by using a shot, it's worth doing, right? Because it removes a whole arm of problems. The other thing that I might add is from a standpoint of logistics. So let's say that you're a parent and you have 3 kids, and they have certain activities. Maybe the schools might be open by then, or so on and so forth. If they get the flu, that's just another reason they're not going to be able to go to school, and it's going to have to be sorted out from COVID. So you'll have to get tested for both, so that you know how long you have to stay home. Because for COVID, you have to stay home for 10 days of onset of symptoms. For flu, you have to stay home for 24 hours after your fever goes away. So knowing the answer to that. So if you've had the flu shot and Johnny doesn't get sick from the flu, it's going to make your life a lot easier, right, as a parent. So that's another good reason. And then the other thing is flu can be a nasty problem, particularly for elderly people and people with underlying diseases. Let's not forget we lose people, a fair number of people every year in the United States for influenza. So let's do something, to help prevent that we can do, and the flu shot's a good thing to do. Now, will flu be less of a problem if everybody's masking and washing their hands and personally distancing? Yeah, probably it will be less of a problem. And in fact, some of the southern hemisphere places, it seems like that might be true. So, but still, let's get a flu shot. It's a real easy way to prevent something we can prevent.
On that same issue of, even before the COVID, there was always tended to be some, you had to deal with a lot of misinformation about the flu shots. Are you concerned about this, or about people thinking, well, it's not going to help me? Because there was always that issue out there before this started.
Yeah, every year there were myths about the flu shot that would pop up, and we'd usually start talking about them this time of year. And so myth number 1, I get flu from the flu shot. You can't get flu from the flu shot because the component in the shot that gives you immunity to flu is deader than a doornail. It just isn't. It can't cause infection. So why does this myth come about? Is that when the flu shots, usually a lot of people get it in October and November, and that's when a lot of the other respiratory crud and colds go around, and so it's just kind of a coincidence that you got your shot when you got a cold a few days later. People blame the shot, but it's not the shot. The other thing about the flu shot is, does it cause immune problems or other things? I don't like getting vaccines because I don't like putting these things in my body. But we've had so much experience with the flu shot now, and it is a safe vaccine. There really aren't any worries about that. All of the population-based studies have shown the flu shot don't cause chronic health conditions. So I'm confident about that. I have no issues with it whatsoever. So the only downside to the flu shot is that the needle's a little bit sharp, and not everyone likes needles. But also, I wanted to say, if you're older than the age of 55 to 60, you might want to think about getting the high dose flu vaccine, because it does confer more protection. The antibody levels are higher. And there's also something called an adjuvant vaccine that has a little bit of a component added to increase the immunogenicity of the flu shot. So if you're older or have chronic medical conditions, consider the high dose or adjuvant vaccine rather than the standard vaccine.
Another question about, with the thing with the flu, having the flu, a bad flu season, just regular flu season this year with the COVID, because they have the same symptoms. People on that guy will know, and what kind of effect is that going to have on hospitals? Right.
Yeah. So the question is that flu and COVID have a lot of the same symptoms. So let's go over the major symptoms. Major symptoms of COVID: fever, cough, and maybe sore throat, and body aches. Flu, fever, cough, maybe sore throat, and body aches. So they're not real different. There are some things that COVID has with it that the flu doesn't. One of those is the loss of smell and taste. Is a much more prominent in COVID than flu. Some of the unusual rashes that pop up now and then with COVID aren't really seen in flu. And shortness of breath is more common with COVID than it is with flu. So those of us in the medical profession can kind of get a hint sometimes by the presentation. But to tell you the truth, for us in medicine, it's going to come down to testing. So we'll need to test for COVID. We'll need to test for flu. So I tell doctors, we're going to sort people into 3 big piles. It's like sorting laundry. 3 big piles. You're going to do the whites, the darks, and then the lights, right? So in this, we're going to sort into a COVID pile, into a flu pile, and into an all other viruses pile. And it's important for us to do this because for flu we have medicines like Tamiflu, and the amount of time that you isolate somebody is different for each one of these. So if you have flu, it's just 24 hours after your fever goes away. COVID's 10 days. And then all of the other viruses you can be a little bit more complacent about. And once you start to feel better, you can go back to work or school. So that sorting is something we're going to have to do. So it's going to make doctors' offices busy this fall.
So you kind of mentioned that earlier about get the flu shot early. Would you suggest that? Would that help?
Yeah, so the CDC and I all say, get the flu shot early. You know why? Because you get busy, other things happen, and it's like, it's November, I didn't get it. Now maybe I'll skip it this year. Get it early, get it done, and get it behind you. And this is a case where procrastination doesn't help much. I'm kind of a procrastinator myself, but for flu shot, I won't be.
You want to talk about temperature?
Oh yeah, we mentioned it earlier about temperature screening. So there's a question: did temperature screening really help? So here's the thing with doing temperature checks. Early on, we were thinking that temperature checks were a way to really help protect workplaces, hospitals, and other individuals. Because if you were temperature checked and your temperature was fine, we were thinking you probably wouldn't have had COVID because we thought everybody with COVID had fever. Well, now we know that 15 to 20% of people who have COVID don't have a fever, even if they're symptomatic with other symptoms. We also know that maybe 20% of people who have the COVID virus may not have any symptoms, including people who in that 48-hour period might have virus before they have symptoms. So for all of these people, temperature checking just doesn't help. I mean, you're not going to find anything with it. Second of all, particularly now in the summertime, their temperature checking's become pretty inaccurate. So if you've been out, outside and it's hot and you've been waiting in line in the sun or something, and we do the skin temperature check, the touchless one, you can register pretty high and not have a fever because it's just because your skin is hot from being outside. And lastly, it's a lot of resources. So for the hospital, for the workplace, for so on and so forth, to be doing these temperature checks. So in the last month or so, a lot of us have been saying, temperature checks don't really help, and they use a lot of resources. So let's just stop doing them because it doesn't really protect you. Now asking the questions and having the person who's coming to a building or a place realizing that if they're sick they should stay home. Yes, that makes a difference. So, but the temperature check itself just doesn't add much. It's just not a good screen. So even Tony Fauci said this week that at the NIH, which is the hospital he works at, and the research center he works at, they've stopped doing it. Most government places have stopped doing it. I've stopped recommending that workplaces do it, and government buildings here in the Triad area stopped doing it. And actually, most of the schools, the private schools that are opening, are going to be saying, if you have a concern that your child may be sick, let them stay home and or check their temperature at home in that environment where it's more accurate. But check the temperature coming in the building just doesn't seem to work. Anything else? All right, a little bit about next week. So next week we're going to have a pediatrician here with me, and so for questions for next week, let's see if we can focus on kids and COVID, and or other health issues with kids as we get into fall. Well, child checks, are they still needed even if they're on online learning? Or what vaccines should I be making sure my kids get? Or I missed my kids' vaccines because of COVID last spring. How do I catch up? So send in your questions on that, and we're going to have a kiddie focus for next Thursday. See you then.